Hey, tonight on Senior Living, you're going to listen and hear a very fascinating and interesting story, one that doesn't come along every day by any stretch of the imagination. This is really a great story, one that you've got to hear. Don't take time to get on the phone to call your friends and neighbors, but they should be listening and watching Senior Living. I'm Doug Theaker. I'm really so glad that you're here. Dr. Shah is with me, and it's always a delight and a pleasure. She's an ophthalmologist, a very, very important person in our community, North Central Ohio, the state of Ohio.
Yes.
Dr. Shah, it's always a pleasure to have you on.
Thanks so much, Doug. You as well. I'm so excited to be here.
Thank you very much.
Yeah.
And you brought a guest that we have tonight on Senior Living.
I did. This is Lori, and we're going to kind of talk about her journey with her mother and her experience through under our care here at ReVision, and some of the stuff that she has experienced while her mother underwent cataract surgery here.
Wow. Lori, thank you very much for being on Senior Living.
Thank you for having me.
Tell us just quickly about you. Who is Lori?
Well, I'm the daughter of Grace Bolter, and I live in Columbus. I've lived and worked here now for the last 12 years, and before that I lived in Michigan.
Ooh.
And I came down here, and I brought my mom down here last year in December, and she has dementia with first stages Alzheimer's, and I met Dr. Shah through Paige, a friend of mine, and we decided that my mother needed to have cataract surgery, that her cataracts, I took her in to have her glasses changed and realized she had cataract surgery. I had no idea. And because of her dementia, I don't think she knew either.
Yeah.
So we decided to have the surgery.
Well, good for you. Tell us how old your mother is.
She was 90 in March.
She was 90 in March.
Mm-hmm.
Now, again, how did you meet Dr. Shah?
Well, I've known Dr. Shah because I went to see her, again, through a mutual friend, Paige, that works at their office. And I went in to try and, to get an evaluation to see if I could, was a candidate for the surgery to get rid of bifocals.
Okay. Well, let me go back to you for just a minute, Dr. Shah.
Sure, Doug.
Okay, now here we are. We're talking about a woman. Lori is bringing you her mother. Extremely important, obviously.
Of course.
Our parents are very dear and near to our heart.
Yes.
But yet, by the same token, I mean, here's a woman that just turned 90 or is going to turn 90.
Right.
Does that intimidate you?
No, I think that the techniques are all the same, but it's just really educating the patient and their loved ones as far as how I can make the surgery as safe as possible. And some of the conversations we had with Lori and Grace were the technique in which I chose to do the cataract surgery. We had decided on femtosecond laser assisted cataract surgery because in that setting with the 90-year-old lens, we know that it's very dense, more prone to complications. I wanted everything to go as smoothly as possible, so we had decided on using laser technology in order to remove the lens. And furthermore, there were other issues with Grace that I felt that the standard lens that's covered by insurance wouldn't do her justice in terms of vision outcomes. So we had decided on doing a toric lens to correct her astigmatism and thereby giving her really great uncorrected vision and allowing her to really enjoy vision without needing to wear glasses, which can be important in a patient with dementia.
Yeah, wow. Lori, when was it that you discovered or you really believed that your mother, I mean, here's a woman with dementia that you've stated, okay, and she's obviously up in years. At what juncture, what signaled to you that there was something wrong?
Well, I think that she had stopped reading, and she was an avid reader.
Oh.
And so she was no longer reading, and she didn't seem to be struggling a lot with her vision, but there were just some things because of the dementia. I thought a lot of it was because of the dementia. Sure. And there were a lot of things that she was experiencing and that I noticed that didn't seem like the mom I had 10 years ago.
Yeah. Well, I mean, we have learned here, just in our interviewing with Dr. Shah, of course, I mean, what a really compassionate and sincere and dedicated professional that she is.
Very much.
and obviously that, I have to believe that gave you a tendency to move in her direction.
Oh, I took my mom to an eye doctor to have her eyes examined, and when he said she had to have cataract surgery, I immediately said I wanted Dr. Shah to do the surgery.
Okay, let me take a quick break, okay, and then we'll come back, continue to talk. Okay, we've got a very fascinating and interesting story tonight on Senior Living. Once again, one of my favorites, Dr. Shah, of course, with ReVision. And again, she has brought one of her, well, actually a patient of a mother, and that's Lori, and you're out of Columbus, right? Mm-hmm. Okay, don't go away. That's the point. We're building the story. We need you to stick with us. We'll be right back. Hey, welcome back to Senior Living. Once again, we're glad that you're here. We really have a very fascinating and interesting story to tell you tonight. And again, with Dr. Shah, with ReVision, who is the instrument in this whole scenario. She is an ophthalmologist, and of course with her is Lori. And Lori, we're talking about your mother, Grace, is that correct?
Yes.
Okay, now, again, you were seeing signs that told you, or you at least thought as a layperson, that your mother's vision was not what it should be.
Correct.
Okay, now let me ask you a very personal question. May we ask you that on TV?
Of course.
Okay, now here's your mother up in age. Did it think, well, you know, it doesn't make any difference, she's not going to be living that much longer, I don't want to insult you or hurt your feelings, but
No.
I've had VA doctors tell me you're going to die anyway.
No.
But please.
I tell my mom all the time she's going to live another 40 years.
Good for you.
And at that point, I just wanted her to have, you know, good vision. I wanted to make sure that her health was better. Her conditions, when I brought her here, she was suffering from malnutrition because of the dementia. She didn't remember to eat.
Oh boy.
And I just wanted to make her healthier, and I want to keep her as long as I can.
Yeah. Bless your heart. Well, that's a good story. You love to hear that sort of thing.
Of course, yeah.
And okay, now your first meeting with Grace.
Yes.
Tell us about that, can you? Do you remember that?
I do, yes. And as with dementia, we know that patients go through some good days, some bad days, but I do remember in our initial consultation, very kind and sweet, but she didn't really realize everything that was going on. So that's a very important thing in dealing with patients with dementia. We want to make sure the family member is there and able to be a second ear, and of course to provide a legal guardianship and consent for me to do the surgery. But Lori was with her mom the whole way through, and I felt so comfortable with talking to Lori and talking to Grace that Lori would be able to kind of guide her through the process, because it is scary, you know, and even Lori was sharing with me on the day of the surgery, she really didn't know why she was there again, and even though we had discussed it several times, and even afterwards, Lori was just sharing with me today that when they were driving home, she said, gosh, my vision's so blurry, you know, because she had just had the surgery done. So having a supportive family member involved in the whole process is very important. So
okay, doctor, help us without being too technical, okay?
Of course.
Because I'm a layman. Anyway, the point of it is, when you first saw Grace, can you kind of give us a run through just exactly what you did to get to the conclusion or to the end?
Oh, sure. So when Grace came in for an examination, of course, even before meeting me, there's a lot of different testing we had to put her through, and she did wonderfully through all of that. So we were doing a specific testing to look at the shape of her cornea, to see what her vision was, to see what she was able to see with her glasses, and even without her glasses. So in the time that I had a chance to look through all of that before I actually met her, and then I went on to do my examination and confirmed definitely that she had pretty advanced cataracts in both eyes, and what I would expect for a 90-year-old lens that has been there for that many years. So then after looking through all of that data, we had a big conversation as far as what the next steps were. And I was very careful not to use such technical terms with her, and I didn't want to scare her by any means and go through the exact technical parts of what I was doing, but simply that I was there to help with her through this process and to make sure that she was in good hands and that she was going to be able to see better after all of this was done. And then from there on, you know, we had talked about what type of lenses we were going to use, and me and Lori really talked a lot about that because it wasn't something Grace was able to really understand as far as what kind of lens to implant at the day of surgery. But Lori, as she said, she really wanted the best for her mother, and given that she did come in with quite a bit of astigmatism in her corneas, we decided that we should go with a lens that will help correct that. And since then, she has been so happy in terms of being able to see for the first time without glasses.
Good for you. Now, do you do both eyes the same day, or did you do it?
So that was the one thing that was difficult. I wish I could have done both eyes on the same day, but we always do one eye at a time.
Okay.
And that's just a safety to make sure everything goes well with the first eye, that there's no infection risk, all of that. And then we successfully did the second eye 2 weeks later.
Okay, well, yeah, another success from an ophthalmologist. Very good. Now, after my understanding is after this is over, regardless of whether it's your mother or me, that requires a certain something in the eye.
Correct.
I'm looking for it.
As far as after the surgery is done? Yes, so what we did for Grace and what we're doing for a majority of our patients is we're able to inject all the antibiotic and the anti-inflammatory at the time of surgery. So that's also nice for her that she didn't need as many eye drops after the procedure. So I know, Lori, you were coming in to administer the eye drops. So there was one drop we had to do to help with the cornea to allow it to clear much quicker, but Lori was instrumental in administering those eye drops.
Now we're going to take a break. We come back, we want to hear the results.
All right.
Once again, you're watching Senior Living. We thank you for that. Great story, great, interesting, fascinating story. You're only going to find those stories right here on WMFD. We're coming back. Don't go away now. Stay with us. Okay, tonight on Senior Living, you're listening to a real live story of a 90-year-old woman, Grace, who had eye issues, and the daughter, and the ophthalmologist, again, Dr. Shah, and we now have concluded to the end. It's all over, and what do you think?
It's wonderful. It's changed her life, and mine too.
Okay, tell us how it's changed your mother's life.
Well, before, my mom has dementia, and she didn't really talk about her friends. She's living in Westerville in an independent living facility, and she didn't name them by name. She just would say the girls, and now I think because she can see better, she knows their names, so she refers to them by name. She has suddenly started doing word search books and is very active with word search books, does them constantly without glasses, and she can see, and she repeats to me often that she is so happy that she can see. When she had the first eye done, she had it done on a Monday, and on Thursday I had the pleasure of being with her when she realized that she could see without glasses. She kept doing this on her face and saying, look at me, I can see. And she said, I don't have any glasses. And she said, can you see me? And I said, yes, I can see you. But more importantly, she could see without glasses. And then she covered her right eye and said, but I can't see with this eye. Why can't I see? And I said, you will in 2 weeks. The first eye was difficult. It took her a while to get used to that. And there was a lot of confusion, what's happened. And but by the time she had the second eye done, I think it had sunk in that she had had cataract surgery and she was going to have the second eye done. So it was a lot easier the second time with her. But she's very happy. She doesn't ask the same questions as often. It seems almost, I know that Dr. Shah and I have had conversations, that when you have surgery like that, that it changes, it can help with your memory. And I have noticed that. Typically, if I do something with her on a Monday, that's it. Monday, we might remember it, but by Tuesday, there's no memory. But I took her to get her state ID on Monday, and they told us it would be 7 days, and on Wednesday they said it would be 7 days when I would get my state ID, so that should be coming this weekend, and it's coming to your house, right? And I was amazed that she remembered.
Yeah.
And there are a lot of little things like that that suddenly she's remembering that she didn't remember before. But I think it's just such a joy to see her happy to not wear glasses. She will tell me, we'll watch television and she'll say, I can see without my glasses. And she'll say, I go like this to reach up and push my glasses up, and then I remember that I don't wear glasses anymore. So she's pretty happy.
Yeah.
Yeah.
What a wonderful story. Thank you, thank you, Dr.
course,
Shah.
Doc.
You're a great person. I mean, just what a wonderful. Well, Lori, one more question for you. What would you recommend of my audience? What would you tell people?
Oh, I would tell them don't wait and to see Dr. Shah. I mean, she was amazing with my mom. Not just the doctor that took her cataracts out, but the person with compassion and understanding, and was just so kind to her. They all were. And she's such a wonderful person, you know, not just the doctor, but a wonderful person. And I say don't wait.
Yeah.
Don't wait, because it really changed my mom's life for the better.
Wonderful, wonderful story. Thank you so much for sharing that with us tonight. I just really appreciate it. What a great story. What a great person. Okay, just, you know, we need to throw in just some logistics here.
Of course.
Where did all of this take place?
Oh, this was done at our office in Columbus, off of Polaris Parkway, and there we do have our own surgery center there, so it makes convenience a little bit easier as far as parking and all of that. And the procedure itself doesn't take very long. Now, with Grace, her cataract was a little advanced, so maybe about 20 minutes, but still very reasonable, and it was done in a very safe, controlled setting.
Okay, now locally, of course, North Central Ohio, where do we go?
Oh, sure. So locally, we're here off of West Cook Road here in Mansfield, and that's one of our offices, and we're able to provide cataract surgery as well here locally. And then as far as for our Columbus area or anywhere in between, you know, we'd be able to see patients over at our Columbus location.
Okay, now once again, hearing this very interesting and fascinating and wonderful story from Lori. Now again, we come into the office on West Cook Road. I'm speaking North Central or Columbus. Can we request Dr. Shah?
Of course, Doug, yes. So of course you can. You just have to let our receptionist know, or when you're calling in to make an appointment, just mention my name.
Okay. Once again, you're watching Senior Living, and we're giving you a story, or gave you a story from Lori and Dr. Shah that is just incredible. And it's a good story. It's the story you want to hear. We're coming back with more conversation, more of you, more of them after this. Okay, we're back, and you're back. Once again, we're talking to an ophthalmologist, and we're talking from ReVision, and of course that's Dr. Shah, and we heard the story about Grace and Lori, her daughter. Okay, now back to you, because you're very instrumental in all of this. People, again, watching, or they know of somebody, and does it make any difference whether we're talking about their parents, their brothers, relatives? Tell us about that.
So as far as, tell me
Coming to see you.
Okay.
I want to come to see you, and we heard this wonderful story about a 90-year-old woman. So you're saying it doesn't make any difference how old you are?
No, not at all. I welcome the opportunity to see any patients here in our Mansfield location. And typically our practice's focus is on 18 or older, but as far as any pathology of the eye that you're struggling with, whether it's decreased vision or glaucoma, macular degeneration, we're able to handle any of those situations.
Okay, Dr. Shah, one of the big things, and I grasp here from Lori, is consultation. I mean, can I come in and just kind of pick your brain, so to speak?
Of course. So we spend a lot of time with our patients. Our consultations typically for an initial consultation is over an hour long, and that includes the testing and then an in-depth conversation with me as far as what I recommend and what I'm seeing. And it's a very lengthy process, but one that I feel is very necessary on the front end. So patients are educated about all of their options and what's going to happen next.
Okay, now part of that involves, of course, there's a cost involved. I mean, do you cover those areas as well, or is that somebody, you pass that on to somebody else?
Of course. So after they're done speaking to me as far as the medical aspect of everything, we do have a surgery coordinator that will meet with every patient, that will go through cost and financials, as far as what their insurance will cover, what they won't, and then as far as what to expect pre and post operatively as well. But I cover a lot of that in my initial meeting as well.
Okay, good for you. And let me go back to Grace for just a moment. Now that this procedure is over and she's back in assisted living and getting along well, now does she come back to you again down the road?
She does. So we usually see our patients back, it's usually 1 day, 1 week, 1 month, and then 3 months. But Grace does have her own optometrist that had referred her over to me. So she's now assuming care with her optometrist that's kind of will take over care from then on.
Okay. Speaking of referrals, do you get a lot of referrals?
We do. A lot of our patients are referred by our optometrists that have been trusted with us in our care, and a lot of word of mouth as well. So that's kind of our two biggest referral sources as far as how we're getting patients in the door.
Well, it should be. You're good.
Thanks, Doc.
Okay, now once again, as far as we're concerned locally, you're going to go to Columbus, obviously, that you indicated with Grace.
Right.
But locally, again, we're talking about West Cook Road. We're talking about ReVision, and of course, the title is wonderful, isn't it? ReVision. I love that title. It kind of fits extremely well, and of course, it fits with you perfectly, without a doubt.
Yeah.
But anyway, right here on West Cook Road.
That's
okay.
true.
Now, again, what do I do? Just come in? Do I make a call? What do you suggest?
So we have a great presence online as well, so you can check out our website. And then as far as calling in, I think the number's here on the screen.
Sure.
So just call in and request an appointment. Yeah. And Doug, I definitely wanted to add one more piece of information to what Lori had talked to about her mother, that with dementia, this is something that's been studied in the past. Even ophthalmology journals, American Journal of Ophthalmology, reported in 2008 that patients that have cataract surgery with a diagnosis of dementia, it certainly can improve their memory and cognition.
Unfortunately, my time is up.
Sure.
Hey, I thank you both so much. I really appreciate it. I'm Doug Theaker. You've been watching Senior Living. What a great story. What a great story. And you're only going to find it here on Senior Living. We thank you very much. I'm coming back next week. Can't beat a story like this. Wonderful, wonderful, wonderful. And good night.